Hi, I am Dr. Saqib, and this is my channel Learning Anatomy. And today we'll discuss the anatomy of the cerebellum. That will comprise of 4 to 5 lectures. So, first of all, you see, this is a brief introduction. This is the cerebellum. Yes, this is its location. This is the occipital lobe of the cerebral cortex, and this is the temporal lobe. So, it is lying over between these, and in front of this medulla oblongata here, this is the medulla and this is the pons. These are the parts of the brain stem, right? So this is the cerebellum over here, and today I will discuss with you its introduction, gross appearance and parts. So in introduction, we'll see its origin. It is originated from a Latin word meaning little brain. It is the largest part of the hindbrain, rhomencephalon, right? Its development, briefly, there is from the alar plates or the rhombic lips of the metencephalon. The cerebellum has three important primary functions. So I have to emphasize that cerebellum, of course, is very, very important in motor activity. So these three primary functions are the maintenance of posture and balance, the maintenance of muscle tone, and the coordination of voluntary motor activity. And I will try to present to you the functions of the cerebellum in a separate lecture too. So the coordination of voluntary motor activity is very, very important. So the cerebellar lesions, they produce symptoms and signs on the same side of the body, ipsilateral, in contrast to the cerebral lesions. The lesions of the cerebrum are contralateral. The cerebellar lesions may cause unsteady gait, tremors, nystagmus, and dysarthria. So in the external features, the structural organization of cerebellum is uniform and similar to that of cerebral hemisphere, right? What does that means? It means that there is a thin layer of cortex outside and a deeper white matter which contains the various cerebellar nuclei, right? So this is the outer cortex. This structure is a cerebellum, right over here. This is a cerebellum, and here this you see this is the outer cortex, and inner is a white matter, and here are present the four deep nuclei in the white matter buried. Gray matter is highly folded to accommodate millions of neurons in a compact area, and the arrangement produced is called arbor vitae. Right here, this is the arbor vitae, which in Latin arbor vitae means tree, tree of life. Tree of life. Here you see the tree-like pattern. This is being produced. This is of course white matter, and these are the foldings, which is known as the folia, right? It's word for folium, right? So these are the projections, and here you see this arrangement of white matter. This is called as the arbor vitae. So I told you already, this is the cerebellum located in the posterior cranial fossa, covered superiorly by the tentorium cerebelli. And here you see the relations again. Once again, this is the medulla oblongata, and this is the pons, and above is actually this is the midbrain. So the cerebellum is lying posterior to the pons and the upper part of the medulla oblongata, and this is also lying to the fourth ventricle. This is cavity is the fourth ventricle cavity, which contains a cerebrospinal fluid. Like this is the flow of the cerebellum. This is the midbrain. It is the cerebral aqueduct, right? Aqueduct of Sylvius, and here you go. This is the fourth ventricle, right? Contains the CSF, and here going below, this is the this is part is the medulla, and this is the pons. So external features, this is rather ovoid, right? This shape of the cerebellum is ovoid. You see, this is a ovoid shape, and this is constricted in its median part. This is the constriction. So these are two cerebellar hemispheres. So the parts of the cerebellum. So this is the cerebellum, and this is whole, and these are the two cerebellar hemispheres, and they are united by this narrow median vermis. This constriction. This is the vermis. This is the vermis. So bulge of the lateral lobe that projects inferiorly posterolateral to the medulla is the tonsil. Now, this is the tonsil, right? So let me enlarge these two pictures for you. You see, this is, this is the vermis, and this is one hemisphere, and this is the other cerebellar hemisphere. And in this was the, above was the superior surface, and this thing is inferior surface of the cerebellum. And here you see, this is the tonsil, I told you already. So cerebellum is connected to the posterior aspect of the brainstem by three symmetrical bundles of nerve fibers known as the superior, middle, and inferior cerebellar peduncles. So peduncles. So there are three peduncles. They connect the various parts of the three parts of the the total parts of the brainstem of three. The lowermost, this is the medulla oblongata, this is pons, and this is the midbrain. So these are connected to the cerebellum via these peduncles, which carry, of course, sensory and motor fibers to that. For the information to and from, it passes through these peduncles. This is the medulla, and this is attached to the cerebellum by this inferior cerebellar peduncle. So this is the inferior cerebellar peduncle. And pons is attached to the cerebellum via this middle cerebellar peduncle. This is the middle cerebellar peduncle. And this is the midbrain, and this is attached to the cerebellum via this superior cerebellar peduncle. So these are the three peduncles. So it is divided into three main lobes. This is the phylogenetic and functional division. Phylogenetically and functionally, there are three main lobes of the cerebellum: anterior, middle, and flocculonodular lobe. So first of all, we'll talk about the anterior lobe, also known as the spinocerebellum. Anterior lobe is known as the spinocerebellum, and it is seen on the superior surface and lies anterior to the primary fissure. So this thing is the primary fissure. This, you could see this fissure. You see the laser, and I can enlarge it for you. You could see this, please. This is the primary fissure, and the part of the cerebellum anterior to that is the anterior lobe. And it receives input from stretch receptors or muscle spindles and Golgi tendon organs through the spinocerebellar tracts. That is why it is called as the spinocerebellum. It is involved in the regulation of muscle tone. Its function is the regulation of muscle tone. Middle or posterior lobe, this is called as a neocerebellum. So, right, though this is the middle lobe, right? So this is situated between the primary and the posterolateral, the uvulonodular fissure. So this is, this is a primary fissure, and let me trace for you the uvulonodular fissure. This is clear on this view. This is, uvula, and this is the nodule, and here you see this is a uvulonodular fissure, right? So this is present between this fissure and this primary fissure. This is the largest part of the cerebellum, this middle or the posterior lobe. It gets massive input from the neocortex via the corticopontocerebellar fibers. It is involved in the coordination of voluntary motor activity. Voluntary motor activity, very important. The smallest lobe, the flocculonodular lobe, also called as the vestibulocerebellum. It is present posterior to the uvulonodular fissure on the inferior surface. It is the smallest lobe of the cerebellum, right? So let me demarcate it in the picture, show you, right? So this is a flocculonodular. So this is a nodule, and this is a flocculus. So this is the, this is that lobe, flocculonodular lobe. And you can see this is the schematic diagram. Very important, you just focus on that. What is that? Oh, this is schematic drawing. I'm showing it to you. Right, you see, this is the flattened view of the whole cerebellum. Both superior and inferior surface are shown in one plane, right? This is a horizontal fissure, and the part anterior to that is the the superior surface, and the part posterior to that is the inferior surface, right? This is the demarcation. So we have flattened over here in one picture. So this is the superior surface, this whole thing, and this is the inferior surface. And of course, this is a flocculonodular lobe, and here you could see this the jugulonodular fissure shown in this schematic manner, right? So this is a various fissures and parts of the this anterior lobe, this is middle lobe, and this is flocculonodular lobe 3 fissure. This is the primary fissure, this is the horizontal fissure, and this is a jugulonodular fissure. So I told you that flocculonodular lobe comprises of nodulus of the vermis, right, and the flocculus. Two things, nodule and the flocculus. It gets input from the vestibular system. It is involved in the maintenance of posture and balance. So I told you we'll discuss in the functions of the cerebellum lecture that the functions which are performed by the cerebellum are compartmentalized. Each compartment of the this cerebellum, some anatomists and neuroscientists divide the cerebellum, vermis and its parts into 10 parts. And I will show you very soon the parts of the vermis and the corresponding part of the lateral hemispheres. That's very interesting. So I told you what is that horizontal fissure is a deep fissure found along the margin of the cerebellum that separates the superior from the inferior surface. This is the thing I told you already. It is insignificant. It is insignificant morphologically and functionally. You see this zoomed in picture, right? This is a horizontal fissure. So this is the superior surface, and below, posterior to that, is the inferior surface of the cerebellum. So very interesting, longitudinal organization of the cerebellum, right? So it has 3 functional longitudinal zones that are related to specific cerebellar nuclei and pathways, right? Here you could see 1, 2, and 3. One is the median zone, which is the vermis, right? This is, you see the laser, this is the vermis. And the second is the paramedian or the paravermal zone, the hemisphere. This is the thing, right? This thing. And the third is the lateral zone of the hemisphere. So let's enlarge, interesting. So this is, you think this is the vermis and various parts. We'll discuss the next slide. And this is the paravermis here and here on both sides. And this is the lateral cortex, right? Lateral lobe parts. These are the 3 parts, longitudinal organization of cerebellum: median zone, paramedian, and the lateral zone, right? So I will tell you in the structure that this vermis contains the nucleus vestigial nucleus, and the paramedian zone contains the interposed nuclei, which are the emboliform and globose nuclei, right? And the lateral zone contains the dentate nucleus, lateralmost nucleus, the largest one, dentate nucleus. So you see, very interestingly, this is the thing. So this is the lingula, and this is the central lobule. To start from anterior to posterior, move like that. This is the parts of the vermis on the cerebellum. Very important. Some of the neuroscientists take a lot of interest and divide the area. I told you already, from first to 10 parts. I have taken this universally accepted division, right? So this is first part is the lingula. I will give you the mnemonic for that as well in the end. Lingula, first of all. Then is this central lobule. Then is this culmen. Then is this declive. Then is this folium. Then is this tuber. Posterior to that is the pyramid. Posterior to that is the uvula. Posterior to that in the last is a nodule, right? So various parts, and the parts corresponding to these lateral to these on the lateral hemisphere, right? The parts of the vermis corresponding to these parts on the hemisphere are the this lingula has no corresponding part on the lateral zone, and this central lobule has this ala on the lateral lobe, and this culmen has this quadrangular lobule, and this declive has the lobulus simplex, and this folium has the superior semilunar lobule, right? This whole thing is the anterior lobe, and going on to the posterior or the middle lobe, this is, you know, tuber, and lateral part is the inferior semilunar lobule. And coming back, part of the vermis, told you again, pyramid, and corresponding part on the lateral hemisphere is the biventral lobule, and posteriorly uvula on the lingula, and laterally on the lobe, on the lateral hemisphere is the tonsil. And then coming back, this is the nodule, part of the flocculonodular lobe, and of course this is the nodule, and this is the flocculus. These are the various parts, and I told you already parts of the vermis. These are enlisted over here, 9 parts, and these are the subdivisions of the cerebellar hemisphere corresponding to these parts. I told you already lingula has no corresponding part, and these are enlisted. I told you and shown you already, and this is a mnemonic. You see this, and you see the words. This is L C C D F T P U N N N. So like cats catching dogs for the party up north. Like cats catching dogs for the party up north. This is the thing, all these words. This L, C, C, D, dogs, and F for the tuber, pyramid, uvula, up, and the north is nodule. So this is the thing. So these are easy to remember, this subdivision. So that's it. So I thank you very much for listening to this very interesting topic, and give me the feedback, and for my encouragement, please like and subscribe my channel. Thank you very much.